Good afternoon, ladies and gentlemen. My name is Elad Golan, and I work for Consensus Cloud Solutions. Really excited to be here today to show you how we're going to improve workflow transformation with AI. In this demo, you will see how technology can be leveraged to expedite care and improve Dr. Martin, our main character, and the care that Isabella, the patient, receives. Dr. Martin is a primary care physician who is overseeing Isabella. Isabella is a 70-year-old woman who lives independently and unfortunately recently had surgery to remove a large cancerous growth on her leg. She was sent home with home care for the nurse to change and check on the dressing. And Isabella's next of kin, her daughter, lives out of state and, of course, as you can imagine, is very concerned about her mother.
My name is Margaret Morris. I work for Matrix Care, and I represent the home health nurse who's delivering care to Isabella in her home. I completed a start of care several days ago, and now I'm returning to see Isabella and notice a significant change in her condition. I've documented in the EMR, and now what I'm going to do is go into the narrative and utilize the integration with Envoke for speech recognition. Post-surgery 3 days ago, patient exhibits signs of infection, including serosanguinous drainage at surgical site, which is also red and warm to the touch, period. Patient also exhibits signs and symptoms of mental status change, including inability to follow instructions, as well as inability to recall the current year, period. All of these symptoms are a change from start of care, period. Now, as this finalizes the dictation, the nurse can then select the text, copy, in order to paste this into a fax we're going to be sending to Dr. Martin directly from the EMR. As this opens up the app, this allows me to go into the contacts list, select the physician, which pulls in the fax number. Now I'm going to customize the cover sheet. Specifically, I want to let the doctor know that this is an urgent matter. And then again, I'm going to paste the information regarding my concerns and send this fax directly to Dr. Martin from my mobile device in the patient's home.
And that's a really important point, because normally a nurse would have had to gone back to her office in order to send a communication to the doctor. Here we're seeing that she's sending it at the patient home. Dr. Martin has been practicing in this office for the past 30 years. Her office is part of a local health system that uses Epic, but many of the other providers might use other tools or even paper fax. And this causes a really big challenge. The different modalities through which she receives new information make it challenging to take action quickly and prioritize which patients need her care the most right then and there. Recently, though, her hospital system moved to a new faxing provider and enabled new features which have significantly improved her workflow. Previously, when receiving a fax from an outside organization, Dr. Martin would have received this on a physical fax machine. The office manager would have to check this fax machine multiple times a day. There could be a stack of papers so high that it's really hard to be able to look through and prioritize which paper goes to who and what's important. However, since moving to the new cloud faxing solution, all documents are sent electronically and are accessible via the online portal and accessible from any device. This significantly improves the office manager's workflow when she sees a notification that a new document has been received and can download it directly to her system. And that's what we're seeing over here on the screen. Now, ladies and gentlemen, for a wow. Recently, the system has added new way to transform the fax image into actionable information. The new service utilizes natural language processing and optical character recognition to process the incoming faxes. In this case, we're able to utilize a fax number essentially as a routing number, and that fax number was provided to all the providers and specifically to the nurse that visited Isabella.
Now that Dr. Martin has received the fax, there is certain information she needs to glean out from the document. She needs to understand the patient demographics and some clinical attributes like which medications or diagnoses the patient has. The way she would do this today is she has to read through the document because it's an unstructured document. This is an 8 pages document. If she has 10 patients a day, we're talking about 80 documents that she has to go through. That is why Mendel AI has partnered with Consensus. Mendel is a machine that is able to understand clinical context and glean insights out of clinical documents. I want to walk you through the life cycle of the document. Step 1 is turning this document from being an image to actually being text. And the very unique thing here is this text conversion is orders of magnitude more accurate than anything that exists today. The reason is it understands clinical context, meaning if the OCR makes any mistakes, the AI kicks in and corrects those. Now, once the machine has converted it into text, step 2 is extracting certain information out of the document. For the sake of this demo, we want to extract some demographics information. We want to know that the name of the patient, the MRN number, the date of birth. Another unique feature here, this AI is not a black box. So every time the AI gleans out any kind of information, it shows you where in the document that happened. So you're able to verify and increase the confidence levels of the machine. It's also served as a JSON format that can be input in several EMR systems. I want to take a second and show what we can also do from the clinical side. So say Dr. Martin wants to know what kind of medications this patient is on. If she simply asks that question, the machine will kick in and will extract all the treatments that that patient was on. Note, this is not a keyword search. It's not looking for the word medication. It actually understands that ibuprofen is a medication. It understands that furosemide is a medication and is able to surface that all in real time. So the document has been taken from being a fax to being an analytics-ready, machine-consumable document, again, in real time.
So we know that fax is very prevalent in healthcare. And what you saw, ladies and gentlemen, was a way that now AI can read the document, pull out the important information, and as a result of this technology, the fax can be processed and a notification will be sent to Dr. Martin that includes the fax image, the OCR output, which was improved by the NLP, the extracted data that's formatted into a JSON file, and the patient demographics that were transformed into a CCDA. Furthermore, the JSON file will include the key value pair for extracted data element, the location within the document, the confidence score, and the presence of handwriting, if applicable. Now, if Dr. Martin wanted to, or if there was a document that had a lower confidence score, she could set up a queue where one of her office assistants can review the information before it automatically gets entered into the EHR. Once the data is received, we're able to route it to where the organization wants to store the information for this number. We can route it to an application behind a firewall. We can make it available via our enterprise API or to an inbox that can receive direct secure messaging and fax data. In this case, we can utilize the Universal Healthcare API to deliver these files however the receiver would prefer. Dr. Martin here specifically wants to receive the files via direct secure messaging. And now, this is really important, ladies and gentlemen. Because the unstructured file is delivered with the structured data elements, this allows for the appropriate routing of the document to the correct patient chart. I'm going to repeat that in simple English. Essentially, what I'm saying is that a document, a fax, is sent. No more is it needed that someone needs to look at the piece of paper and read it to then file it to the right patient. Right now, the AI is able to read the document and automatically file it to the correct patient chart. That's absolutely incredible.
I'm playing the role of Dr. Martin using Epic. I'm currently treating Isabella, and the first thing I want to do is see what care she's received at other organizations. To do so, I'm going to go to the Care Everywhere Outside Records activity in Epic. Here we can see that since the information from ABC Home Care was sent as a direct secure message with the discrete patient demographic information, it's already here for me to view. I can click on the continuity of care document and view the care that she received. With this information, I can now treat Isabella and complete my visit.
So just to summarize, so far, what we saw was that a fax was sent in the field with the patient. The AI was able to process the fax, and right now, the message was delivered to Dr. Martin, alerting Dr. Martin that Isabella is recovering from surgery, and that actually Dr. Martin needs to pay closer attention because Isabella needs to be readmitted to the hospital. Dr. Martin is able to quickly contact services to pick up Isabella and bring her to the main hospital. And now this is really important. Because the files were delivered to the Epic system in a structured way, the surgical team will already know that Isabella is coming and can prepare for her arrival. That's delivering significantly better patient care. Dr. Martin's also able to contact Isabella's daughter and let her know that her mother will be readmitted. And since Isabella is currently confused, she's not able to consent for care. So, Dr. Martin can send Isabella's daughter a consent form with an online electronic signature tool called JSign, and her daughter can fill it out and sign it while still on the phone with Dr. Martin. Just for background, JSign is built using blockchain technology that adds a heightened level of security. Dr. Martin is able to return the signed document and add it to Isabella's record automatically. Then Dr. Martin can send a referral to long-term care to have Isabella admitted for her recovery.
In order to do this, I'm going to send a fax, and that's the preferred communication method for ABC Home Care. To do that, I'm going to go to the Communications tab, create a new communication to long-term care, and add my visit summary. Then I can click Send to send it through the eFax connector back to ABC Home Care.
So this completes the care coordination loop all within the same workspace. And I just want to end with these points. And please, these are the most important points. So if you took anything away, it's the following. What normally would have been a very cumbersome and very complicated process has now been expedited. From a clinician's perspective, a fax was sent from a mobile device and the information was available at the EHR in near real time. 2, because it was sent via fax and direct secure messaging, there was no special development that was needed. Rather, we're just leveraging existing tools and able to make this significantly more valuable to everyone. 3, by using a fax number as a routing number, we were able to leverage this legacy technology that's widely adopted and available to everyone in order to transform it into multiple digital assets that can be further used. And 4, finally, even for organizations that may not have the latest healthcare technology, can still leverage this incredible AI and OCR and NLP and machine learning, all with just a really simple fax number. That's absolutely amazing, and that's going to bring significantly better workflows and reduce all the friction points. We hope you enjoyed your demo. Thank you very much for listening to us.